Alrighty, everybody. So, welcome back to our online lab. Today, we're going to begin our muscles unit, and today we're going to talk about the muscles on the head, face, neck, trunk, thorax, abdomen. So, essentially, all of our trunk muscles. And then next week, we will cover muscles of the upper extremity, so of the arm and the shoulder, and the forearm and the hands. And then the week after that, we'll do the muscles of the lower extremity. And that will wrap up our muscle section. So today we'll get started. I've got several videos in here for you guys. And I'm basically just going to be walking through some muscles with you, telling you what to expect from the exam, and we will go from there. All right, so the way that we're going to proceed through this lecture is first that I'm going to talk to you guys about the head, the neck, and the face muscles. Then we will go through muscles of the anterior trunk and the thorax, and then finish up with muscles of the posterior trunk. Okay, so for the muscles of the head, neck, and the face, everything that you see here in black, you will have to identify these muscles on diagrams. And that's all you have to do with those muscles. Now with muscles 10 through 14 down here in red, I'll ask you guys to ID them on diagrams, but also know the origin, insertion, action, and innervation of each of these muscles. So let's go ahead and get started. And we'll get started here with the occipitalis muscle, also called the frontalis and the occipitalis, but we have merged them into one so for all intents and purposes of this video, that's the way that it's set up. So I'll go ahead and click on this and just show you this is where it's located. Okay, so that one you'll just have to ID. Here is the orbicularis oculi muscle, located around the eyes in a circular fashion. Orbicularis oris muscle, located around the mouth in a circular fashion. Here is the buccinator muscle, and the buccinator muscle is sort of deep in there, and let's learn about it.
The origins of buccinator are from the posterior alveolar margins of the maxilla and mandible, and from a band of connective tissue running vertically between the two, known as the pterygomandibular raphe. At its insertion, buccinator blends with fibers of the orbicularis oris. Buccinator compresses the cheeks to hold food between the teeth while chewing. It is innervated by the facial nerve.
So this is an example of some of the videos that I'll have in this lecture for you. All of these images are taken from the visible body courseware. And so if you look in our Sakai site, you'll see a link to register for this site. So you guys can actually go in and play around with this and locate these muscles on your own. Again, that's located in our Sakai site, listed under number 3 for this week's activities. Okay, and then all of these videos are taken from the Mastering A&P Pearson online website for Human Anatomy and Physiology by Mary Manhoen. Okay, all right, let's continue. All right, so here is the platysma muscle. the zygomaticus major and the minor. So the major are these two, more inferior and laterally, and then the zygomaticus minor are the more superior medial muscles. And then finally is the risorius muscle. And so if you remember, here is the zygomaticus minor, zygomaticus major, buccinator, deep back there, and the risorius muscle. Okay, so now we've reached the point of the muscles that you'll have to know the origin, insertion, action, innervation of. And the first one on our list here is the masseter. So the masseter muscle is located on the lateral side of the face, and it originates, remember, an origin is the part of the muscle that's going to be attached to the non-movable bone. And so in this particular instance, it's going to be our cheekbone. So it's going to be originating from the zygomatic process in the arch. It's going to insert onto the movable bone, which in this case is the mandible, specifically the angle in the ramus of the mandible. And what it does is it is actually, as you can imagine, it's going to shorten and elevate the mandible. So whenever your mouth is open, this muscle would be longer. And in order to close your mouth, the muscle fibers then would shorten, which would elevate the mandible. It is innervated by the trigeminal nerve, and here's a quick little video for you.
The origins of masseter are from the medial surface of the maxilla and the medial surface and inferior border of the zygomatic arch. The insertions are to the lateral surfaces of the angle and ramus of the mandible. Masseter closes the jaw. It is innervated by the mandibular branch of the trigeminal nerve.
So for all intents and purposes, you're going to get a little bit more detail in these videos, but as for origin, insertion, action, innervation, just know what I have written here. Most of the time it's pretty close to what they say in the video. The video might have a little bit more details. I tried to shorten it up a little bit so it wasn't quite so much for you guys have to memorize.
The origins of
All right, so the next muscle here is the temporalis muscle. It originates over the temporal fossa of the temporal bone, and it inserts into the coronoid process of the mandible. So when we had the mandible, it's going to have the angle, and then we had this little end piece with two pointy parts going to attach to the more anterior pointy part, which is called the coronoid process. Its job, the job of the temporalis muscle, is to elevate the mandible and also retract the mandible or pull it posteriorly. It is innervated then by the trigeminal nerve.
The origin of the temporalis is from the temporal fossa. The insertions are to the coronoid process of the mandible and to the portion of the ramus below it. Temporalis closes the jaw. It is innervated by the mandibular branch of the trigeminal nerve.
All right, so next is the sternocleidomastoid. And sternocleidomastoid, I've mentioned this muscle before whenever we were learning about the markings on bones. I mentioned that a lot of times it makes it so much easier if you know the markings of the bones, because sometimes muscles are named based on those markings. So this is an excellent example of that, where sternocleidomastoid originates on the manubrium of the sternum, which is where we have the sterno part. So let's draw that out. So the sterno part comes from the manubrium of the sternum. The cleido part comes from this origin, the medial third of the clavicle. And then, of course, the mastoid part of sternocleidomastoid is because the muscle inserts onto the mastoid process. So this is one that it's really easy to remember the origins and insertion because the muscle is literally named for the origins and the insertions. So again, here we have the sternum. Here's the medial third of the clavicle inserting up onto the mastoid process of the temporal bone, which is kind of what you're seeing here, the mastoid process of the temporal bone. Let's play this quick little video. And I'll pause it there so you can see the medial third of the clavicle, and then also you can see that it is inserting into the manubrium of the sternum, which we know the manubrium is that top part of the sternum. Finally, as far as action goes, sternocleidomastoid is going to flex the head. Okay, so head flexion, just draw that in. So it's going to flex the head. So we're going to look this way. And it also does contralateral rotation. Okay, contralateral. What does that mean? Contralateral means opposite side. So what I mean by that is that whenever sternocleidomastoid shortens, right, because during muscle contraction, the muscle is going to get shorter. When that shortens, you can see that it would pull on this part of the head, right? And so the motion we get is looking, in this case, if it's the right sternocleidomastoid that's contracting, we're going to look left. And if you're having trouble kind of grasping this idea, go ahead, turn your head to the left, and on your neck, just lateral to the jugular notch, so kind of right over your throat, you'll feel a muscle pop out when you turn your head to the left. That's your sternocleidomastoid muscle. Right, so once you have found that, put your head back facing forward, still holding onto that muscle, turn your head to the left and you'll feel that muscle contract. Okay, so that's just what I mean. I just wanted to be clear what I meant by contralateral rotation. So that means when the right sternocleidomastoid contracts, our head turns to the left. When our left sternocleidomastoid contracts, our head turns to the right. And then finally, the sternocleidomastoid muscle is innervated by the spinal accessory nerve. All right, so the next muscle on our list here is the splenius capitis. And the splenius capitis originates on the ligamentum nuchae. And just so you guys know, that would be this point. Okay, so you see this sort of tendinous fiber band here. That's the ligamentum nuchae. And it also originates on the spinous processes of C7 through T3. Okay, so that's sort of what you're seeing. That's what I tried to give you in this picture, that you can see that it's originating also from the spinous processes. And as a reminder, the spinous processes are the part of the vertebral column that you can actually feel on your own back. Okay, it's sort of that medial posterior part that sort of sticks out. The splenius capitis inserts onto the mastoid process. Okay, so it's inserting onto the mastoid process, which you can see. And it also inserts on to what's called the superior nuchal line of the occipital bone. And essentially that would be this part here, okay? So we have the external occipital protuberance, if you guys remember that bone marking, about right there. It's that bump on the back of your head that everybody has and you can feel. You have a couple of lines that kind of run with those bumps. So you have a superior line that runs with that bump, and then you have an inferior line that runs with that bump. And the superior line is the superior nuchal line, and that's the one that the splenius capitis is going to insert into. And so in terms of motion, what kind of motion is the splenius capitis doing? It is going to do head extension. And I'm sure that you guys kind of can understand that if this muscle on both sides, if both muscles contracted at the same time, that would bring our head backwards, right? Additionally, if we look at it from a standpoint of if only one side is contracting, then if only this side is shortening, then that's going to perform ipsilateral flexion. So ipsilateral, it's another new word. Ipsilateral means same side. Okay, so same side. So flexion to the same side, specifically in this case, it's going to be lateral flexion. So it's going to kind of tilt our head this way, right? So sort of given the what look. And then also rotation. So because this muscle is going to shorten, it's going to rotate our head. Okay. All right, so let's watch this quick video and you'll get a better sense of this.
The origins of splenius capitis are from the inferior half of the ligamentum nuchae and the spinous processes of C7 through T3. The insertions are to the mastoid process of the temporal bone and the superior nuchal line of the occipital bone. Acting bilaterally, the splenius capitis extends the head and neck. Acting unilaterally, it extends and laterally flexes and rotates the head and neck to the same side. It is innervated by the dorsal rami of the cervical spinal nerve.
All right, so I just want to point out again, unilaterally, so that means if you're only contracting one side, we're going to be flexing to whatever side is contracting. So if this side is contracting, in this case is the left side is contracting, then your head is going to tilt with your left ear towards your shoulder. Additionally, if this side is contracting, it's going to pull your head to the left. Okay, so if this muscle is getting shorter, okay, we're going to get shorter. That means it's going to turn our head to the left, okay? So that's ipsilateral flexion and rotation. So lateral flexion and rotation to the same side, okay?
The origins of splenius capitis.
So the next muscle that I will talk to you guys about is splenius cervicis. So we just talked about splenius capitis, and splenius capitis was this muscle more superior here. And then we have splenius cervicis. And just a quick way to keep these sort of separate in your mind, capitis usually refers to the head, And you can see that the splenius capitis is actually going all the way up to the head, whereas the splenius cervicis originates on the spinous processes of T3 to T6, which is what you see down here. And it inserts into transverse processes, which is what I try to show you over here, to these transverse processes, which are the two little, pointy projections on the lateral sides of the vertebra, if you remember from the bone markings. And in terms of action, the splenius cervicis is going to extend the head, right? So it's going to pull the head sort of back and allow you to look up. It also performs lateral flexion. Okay, so when this one contracts, you look our head, right ear to the right shoulder, and then if this one contracts, I'm going to do left ear to left shoulder. Okay. And then also ipsilateral rotation. So the exact same thing as the splenius capitis, rotation to the same side. So I'll play this quick little video for you. And this is just showing you the different markings and such that you can see as terms of origins and insertions. Okay. All right, so I gave you this table so that you have sort of a summary list of the muscles that you have to know the origin, insertions, actions, and innervations for. And now we can move on to the muscles of the anterior trunk and the thorax. So for the exam, you have to be able to identify all of the muscles that are on this list. For the muscles listed in red, just like with the last muscles that we were just talking about, you'll be asked to know the origin, insertion, action, innervation. And then for these muscles that are listed in green that are italicized, I just want you to know the actions. So let's take a look. We're going to start here with pec major. Okay, so I'm just going to identify pec major on some of these diagrams for you, and then I'll let you listen to this video. So here would be pec major. I outlined pec major on this cadaver image for you. Here's pec major using that visible body courseware. And let's watch this video.
The pectoralis major is the large superficial muscle of the arm located in the anterior thorax. It may be separated into two groups of fibers, superior or clavicular and inferior or sternocostal. The origin of the superior or clavicular fibers is from the anterior surface of the medial one-half of the clavicle. The insertion is to the lateral lip of the intertubercular groove of the humerus. The origins of the inferior or sternocostal fibers are from the anterior surface of the sternum, the costal cartilages of ribs 1 through 7, and the aponeurosis of the external oblique muscle. The insertion is to the lateral lip of the intertubercular groove of the humerus. Acting as a whole, the key actions of the pectoralis major are medial rotation and adduction of the arm. Medial rotation is a movement during which the anterior surface of the arm turns toward midline. Adduction is a movement in a medial direction toward the midsagittal plane. The pectoralis major also assists in flexing the arm at the shoulder.
All right, and finally, the pectoralis major is innervated by the pectoral nerve.
The pectoralis.
All right, so here is a muscle, the pectoralis minor. This is just one that you have to identify only. And so I gave you some different views of this. So from your lab manual, you get this picture of the pec minor, right? And so this one would be deep to the pec major, all right? And so on this visible body courseware, I left in the pec major, which is what you see here. I just faded it out so that you can see the pec minor down here. So just deep to that. And then here's the matching pec minor on the opposite side. Pec minor again. And so if you remember, here was pec major on the cadaver image. Basically what would have had to have happened is they would have had to cut pec minor away right here and flip it out. And then you will see pec minor. Okay, so let's watch this quick little video.
The origins of pectoralis minor are from ribs 3 through 5. The insertion is to the coracoid process of the scapula. With the origin fixed, pectoralis minor tilts the scapula anteriorly. With the insertion fixed, it draws the rib cage superiorly to aid in forced inspiration. It is innervated by the pectoral nerve. The origins.
So the next muscle here is serratus anterior, and serratus anterior, it's kind of sort of an easy one to remember because the word serratus, I think of like a serrated knife. And if you're not sure what I mean by that, a serrated knife is one that has like the little sort of teeth. Okay, sorry, that drawing's like not perfect, but serrated means it kind of has this teeth-like situation. And as you can see, this muscle has this feathery teeth-like sort of situation going on here. So let's learn about it.
The origins of serratus anterior are from ribs 1 through 8. The insertion is to the costal surface of the medial border of the scapula. Serratus anterior abducts the scapula and laterally rotates the scapula upward by moving the glenoid cavity superiorly and the inferior angle laterally. The superior fibers elevate the scapula, while the inferior fibers depress it. It is innervated by the long thoracic nerve.
All right. So moving on, again, this is one that you'll just have to identify. You won't have to know anything else.
The origins.
All right, so next we'll talk about the abdominal muscles. And I gave you this picture first, just to give you an idea of how you would see these actually in the body. So the first abdominal muscles that you would see most superficially is the external obliques. And then once we cut the external obliques away from the midline and pull them back, that's when you'll see the rectus abdominis and the internal obliques. Now, once you've reflected the rectus abdominis, and in our cadaver, what I did is I cut the rectus abdominis up here from the xiphoid and away from these ribs and pulled it down this way. And then I cut the internal oblique away from the midline and reflected it sort of outways. And that's when you see the transversus abdominis. Okay, and so that's the deepest muscle of these three muscle layers. Now just pay attention and notice fiber direction here, because fiber direction does matter. You'll notice the external oblique fiber direction sort of running in this direction, internal oblique runs sort of in multiple directions. Okay. Rectus abdominis is fibers running straight up and down, and then transversus fibers are literally running transversely to the body, so sort of straight across the body. Okay. This is just important so you can kind of get an idea of if this muscle were to contract, what would that, look like, and if this shortens, then what kind of motions are going to occur. Okay, so that's really the only point of me trying to sort of get you, stimulating you to think about that stuff. All right, so let's start with the rectus abdominis. This is one that you have to know the origin, insertion, action, and innervation for. Rectus abdominis is virtually the six-pack. And so it originates down here on the pubic symphysis and also the pubic crest. And it goes all the way up to the xiphoid process and also inserts into the costal cartilages of the 5th to 7th rib. It's innervated by our intercostal nerves, and so here's rectus abdominis on a cadaver image, here and here. Rectus abdominis on this image, and notice that rectus abdominis muscle is slightly deep to the fascia of the external oblique muscle. Okay, so let's watch this quick little video.
The origins of the rectus abdominis muscles are from the pubic symphysis and the pubic crests. The insertions are to the xiphoid process of the sternum and the costal cartilages of ribs 5 through 7. The rectus abdominis muscles flex the vertebral column anteriorly. Rectus abdominis muscles also increase intra-abdominal pressure for abdominal breathing as during childbirth. They are innervated by the intercostal nerves.
Okay. So next is the external oblique muscle. And this is one that you just have to know the action for, okay? So external oblique, you just need to know the action. Here is a diagram of the external oblique muscle, external oblique, and out here on the cadaver image of external oblique. Let's see.
Acting bilaterally, the external obliques support and compress the abdomen and flex the vertebral column anteriorly. Acting unilaterally, the external oblique laterally flexes and rotates the vertebral column to the opposite side. Due to the compressive effect on the abdomen, the external obliques raise intra-abdominal pressure and assist in forced expiration. They are innervated by the intercostal nerves.
All right, and then so just deep to the external oblique. So here on this image, you can see on our little muscle man's left side is his external oblique. Just deep to the external oblique is where you'll find the rectus abdominis and the internal oblique, sort of over on that love handle area-ish side of things. And on our cadaver image, here's the internal oblique and internal oblique and rectus abdominis here. Okay, so let's see about internal obliques.
Acting bilaterally, the internal obliques support and compress the abdomen, raise intra-abdominal pressure, and flex the vertebral column anteriorly. Acting unilaterally, the internal oblique laterally flexes and rotates the vertebral column to the same side. Due to the compressive effect on the abdomen, the internal obliques assist in forced expiration. They are innervated by the intercostal nerve. laterally.
All right, so next is the transversus abdominis, and again, just know that you'll have to be able to know the action for the transversus abdominis and know where it's located.
The transversus abdominis muscles compress the abdomen and in doing so raise intra-abdominal pressure and assist in forced expiration. They are innervated by the intercostal nerve.
So here is the list of the muscles of the abdominal wall and their actions here for the ones that you have to know the actions for. So now we'll talk about some of the muscles that are important for respiration, which is the process of breathing. And so first we'll talk about the diaphragm. The diaphragm is our primary inspiratory muscle. So this muscle contracts whenever we breathe in. And notice that during the relaxed phase, it's more of this umbrella shape. And during contraction, this muscle actually moves downwards. Okay, and by moving downwards, that creates more space in the thoracic cavity for the lungs to expand. Now, it's also important to know that the diaphragm also helps in forced contraction during things like defecation, urination, and during child labor. So you can imagine, think child labor, for example, whenever the patient is told to push, the diaphragm contracts, and that actually causes the diaphragm to move inferiorly, which then would push down on all the abdominal organs, thus pushing down on the baby as well for delivery. Okay, so we're just going to watch just a short part of this video. So you can see the diaphragm in action. So during breathing in, it's moving down. During breathing out, it's relaxing. Okay. Next, we're going to talk about the external intercostal muscles. And for external intercostal, I want you to know origin, insertion, action, innervation. And I just want to point out here that fiber direction does matter. Okay, so as you can see for the external intercostal muscles, the fiber direction is this way. And that is matching. I showed you the left side just to match this because this would be on the left side of the body. Okay, and so here's the left side of the body. External intercostal muscles are having that fiber direction. Up here in the video, since we're seeing the right side of the body, the external intercostal muscle fiber direction is this way, okay, just so you know. And intercostal means between ribs. So the external intercostals are going to originate on the inferior border of each rib. Okay, so the inferior border of the rib, and going to insert to the superior border of the rib below. So the superior, the top border of the rib that's right below it. Okay, so there. Okay. As far as the action goes, the external intercostal, they're actually going to elevate the ribs during inhalation. So as we know, the origin is the part of the muscle that's attached to the bone that isn't moving, and the insertion is attached to the bone that is going to move. And so since we're inserting onto the rib below is going to be the one that's moving. Okay, and it's actually going to move upward. And if you can imagine, it moving upward that's going to make the rib cage bigger. So let's see that on this video.
The origins of the external intercostals are from the inferior borders of the ribs above. The fibers pass obliquely and inferiorly to insert onto the superior borders of the ribs below. The external intercostals elevate the rib cage during inspiration. They are innervated by the intercostal nerve.
Okay, so that just gives you sort of a live play of how they are actually moving if you have a hard time kind of imagining how they would move.
The origin.
So next is the internal intercostals. And again, remember I said fiber direction matters. And so for the internal intercostals are going to originate on the superior border of each rib. Okay, internal intercostals. And they're going to insert onto the inferior border of the rib above. Okay. Now we have, in this instance, the bottom rib being the fixed one, the one that's not going to move, and the top rib, the rib above it, being the one that's going to move. So when the muscles shorten, it's actually going to bring the top rib towards the rib below it. This depresses the ribs, okay? And thus this would help with exhalation. Specifically, this helps with forced exhalation. So normally when we breathe out, it's just the muscles, specifically it's just the diaphragm and the external intercostals just relaxing. But if all of a sudden I were to be like, okay, breathe hard out, breathe out every little extra bit of air that you can, that's when our internal intercostals would come into play. So during forced exhalation, and they're innervated then by the intercostal nerves, which makes learning the innervation quite easy. But let's see these in action.
The origins of the internal intercostals are from the superior borders of the ribs and costal cartilages below. The fibers pass superiorly and anteriorly to insert onto the inferior borders of the ribs and costal cartilages above. The internal intercostals, especially the posterior portion, depress the rib cage during forced expiration. They are innervated by the intercostal nerves.
So I just want to point out the part where it showed you the forced expiration. In order to sort of appreciate this and see this, you have to, the ribs had to be enlarged first. You had to have gone through inspiration. So it was the exhalation factor that depressed the ribs. Okay, so I just wanted to point that out so that there was really no confusion there.
The rib cage during forced expiration.
So
depress the rib cage during, especially the posterior portion.
This part.
Depress the rib cage during forced expiration.
Okay, so I just wanted to clarify that.
The origins of.
Right, and here's a table showing you the origin, insertion, action, innervation of those respiratory muscles. All right, so now we'll move on to the posterior trunk, and this will be the last portion of the lecture. So again, for the muscles that are in red, you need to know origin, insertion, action, innervation. So that's going to be the trapezius, latissimus, and our 3 erector spinae muscles. And then for the muscles in green, you just need to know the actions. So rhomboid, major, and minor, you only need to know actions. But for all of them, you need to be able to identify them if I give you a picture. So starting with the trapezius muscle, the origin of the trapezius muscle is from the external occipital bone. here. And then also the spinous processes of C7 through T12. So that would be about here. Okay, we'd have the spinous processes. Okay. The trapezius muscle is going to insert into the lateral third of the clavicle, right? So it's actually going to wrap around to the front of the body, which is what you see over here. Okay, the lateral third of the clavicle. Also to the acromion of the scapula, which we would have about right here. And to the spine of the scapula, which we see right there. Okay, so to the spine of the scapula. In terms of its actions, unilaterally, it is going to laterally flex and rotate the head to the opposite side. And bilaterally, it's going to extend the neck, it's going to elevate the scapula, laterally rotate the scapula, adduct the scapula, and depress the scapula. And the trapezius muscle is innervated by the spinal accessory nerve. So again, here's the image on the visible body platform. And then I unhighlighted it so you can sort of see the fiber directions going on here. And then the trapezius muscle on the cadaver, we can see here. Okay, sort of this diamond shape. And then we're going to watch this quick little video showing different stuff.
The trapezius is the large trapezoid-shaped muscle located in the posterior thorax and neck. It may be separated into 3 groups of fibers.
So this video is going to go through the 3 different groups of fibers and their origins and insertions. As for the exam, just know the stuff that I have written over here, but by separating it into 3 groups of fibers, it just makes it a little bit easier to understand and talk about. Okay, and also when you look down here at the picture, you can kind of see how the fiber direction sort of changes in sort of these 3 planes. So in this superior portion, fiber direction is kind of running this way. In this middle portion, fiber direction is kind of running this way. And then in the inferior portion, you can see fiber direction sort of running this way. All right, so that's why it splits it up into 3 different sections. Okay, so let's resume this video.
Superior, middle, and inferior. The origins of the superior fibers are from the external occipital protuberance, the superior nuchal line, the ligamentum nuchae, and the spinous process of vertebrae C7. The insertions are to the lateral 1/3 of the clavicle and acromion of the scapula. With the origin fixed, the superior fibers elevate the scapula, gliding it toward the skull. The superior fibers also laterally rotate the scapula upward. With the insertion fixed and the muscle contracting on one side only, the superior fibers laterally flex and rotate the head and neck to the opposite side. With the insertion fixed and the muscle contracting on both sides, the superior fibers extend the neck. The superior fibers are innervated by the spinal accessory nerve. The origins of the middle fibers are from the spinous processes of vertebrae T1 through T5. The insertions are to the medial border of the acromion and the superior lip of spine of the scapula. With the origin fixed, the middle fibers adduct the scapula. This is a gliding movement toward midline. The middle fibers are innervated by the spinal accessory nerve. The origins of the inferior fibers are from the spinous processes of vertebrae T6 through T12. The insertion is to the tubercle of the spine of the scapula. With the origin fixed, the inferior fibers depress the scapula, gliding it inferiorly. The inferior fibers also laterally rotate the scapula upward. The inferior fibers are innervated by the spinal accessory nerve. The trapeze.
All right, so the next muscle is the latissimus dorsi muscle. And this one has origins from the iliac crest. Okay, so when you put your hands on your hips, you're feeling your iliac crests. Hopefully you guys remember that. It also originates from the spinous processes of L5 through T7. So it's going to be like approximately that region. And also it's going to originate on the ribs, which would be just deep to the muscle, right? So those last 4 ribs, you can imagine here. I'm going to draw them in best I can. So those last 4 ribs, 8 through 12, 5 ribs, excuse me, are also going to be an origin. And it is going to actually insert onto the intertubercular sulcus or intertubercular groove of the humerus, which, remember, is that depression between the greater and the lesser tubercle on the humerus. As for actions, it's going to extend the arm, adduct the arm, medially rotate the arm, and also helps to raise your body whenever you're climbing. And it's innervated by the thoracodorsal nerve. So the latissimus is this one here, and as you see highlighted over on this side. And on our cadaver image down here, we can see that would be the latissimus on that side, and approximately, give or take, muscle fibers on that side, but it would also include this fascia down here, which is the thoracolumbar aponeurosis. Okay, so technically then that makes the latissimus extend this whole section. Okay, let's watch this quick little video.
The latissimus dorsi is the large triangular-shaped muscle of the upper limb, which has an extensive origin from the posterior thorax and abdomen. The origins of the latissimus dorsi are from the posterior lip of the iliac crest, the spinous processes of vertebrae L5 through T7, and ribs 8 through 12 via the thoracolumbar fascia. The insertion is to the intertubercular groove of the humerus. Latissimus dorsi extends the arm at the shoulder. From a state of flexion, it moves the arm to an anatomical position or to a state of extension, and beyond this to a state of hyperextension. It also adducts the arm by moving it in a medial direction toward the midsagittal plane, and medially rotates the arm by turning the anterior surface of the arm toward midline. Latissimus dorsi is innervated by the thoracodorsal nerve.
So next we have rhomboid major, and again, this is one that you just have to know the action for. So rhomboid major, I have it highlighted here in blue. So in this top picture, it would be this muscle, and on our cadaver image would be this one. The rhomboid major is going to elevate the scapula or bring it superiorly. It's also going to adduct the scapula, so bring it towards the vertebral column. So when you kind of pull your shoulders back, like rowers often do. That is what I mean by adduct the scapula. And then it's also going to medially rotate the scapula inferiorly. And this video down here will give a better display of that. So let's watch it.
Rhomboid major elevates the scapula, adducts the scapula, and medially rotates the scapula downward by moving the glenoid cavity inferiorly and the inferior angle medially.
Okay, so basically what that was showing you was that the rhomboid major, when it contracts, this inferior angle of the scapula moves towards midline. Okay, and because of that, that rotates this section sort of this way. Okay. As for rhomboid minor is located just superior to the rhomboid major. So we can see it highlighted in blue here. So here was rhomboid major, and you can see rhomboid minor just superior to that, rhomboid major and rhomboid minor. And then our cadaver image highlighted in purple here is the rhomboid minor. This one is going to do the same things that the rhomboid major do. So it's going to elevate the scapula, so move it upwards towards the head. It's also going to adduct the scapula or move both scapulas toward the midline here, and also medially rotate the scapula inferiorly. So let's see that happening.
Rhomboid minor elevates the scapula, adducts the scapula, and medially rotates the scapula downward by moving the glenoid cavity inferiorly and the inferior angle medially. Rhomboid.
So our last group of muscles here to talk about are the erector spinae muscles, and this is going to be composed of 3 different muscles: the iliocostalis, which is the most lateral muscle, the longissimus, which is the middle muscle, and then the spinalis, which is the one that's located right on the spine. Okay. So we've got ILS and spinalis. If you can remember ILS and remember that spinalis is the one that's always on the spine, then you can kind of go through those muscles in your head, knowing, okay, iliocostalis is most lateral, then we have the longissimus, and then spinalis. And these are called the erector spinae muscle groups because their whole purpose in our bodies is to help literally keep our spine erect, help us maintain posture, and do those sort of things. So let's take a look at them. So the iliocostalis originates on the iliac crest, which is where the ilio comes from. So we get the ilio part coming from this iliac crest. And then we have the costalis part, and by now we all should know that costal refers to the ribs because this particular muscle is going to insert onto the angles of the ribs, but it also inserts onto the transverse processes of the cervical vertebra. Working together, the iliocostalis will extend the vertebral column, so sort of doing almost like starting into a back bend. And then unilaterally, so if only we're just going to contract just one at a time, so if we just contract this one over here, that's going to laterally bend our vertebral column, which means we're going to sort of do this motion to one side. Okay, so let's see this in action in our video.
The erector spinae, the prime movers of back extension, consist of 3 superficial columns of muscle in the posterior neck and trunk. These are the iliocostalis, the longissimus, and the spinalis. The iliocostalis forms the lateral column, and like the others, it has three parts. These are iliocostalis lumborum, iliocostalis thoracis, and iliocostalis cervicis, from their origins.
So I'm just going to pause that right there because for the purpose of our exam, you just need to know the muscle as a whole. But just so you know, it's broken up into the iliocostalis lumborum, which is the part that is going to be level with the lumbar spine down here. The iliocostalis thoracis, which is going to be the part that is corresponding to the thoracic vertebra. And then the iliocostalis cervicis is going to be the part that corresponds to the cervical vertebra.
The erectors spinae, the prime movers of back extension, consist of three iliocostalis thoracis and iliocostalis cervicis, from their origins. Iliocostalis fibers run superiorly to insert onto parts of the vertebrae and ribs. The origins are from the sacrum, the spinous processes of vertebrae L5 through T11, the iliac crest, and from the angle of ribs 12 through 3. The insertions are to the angle of ribs 12 through 1, and the transverse processes of C7 through C4. Acting bilaterally, the iliocostalis extends the vertebral column and neck. Acting unilaterally, the iliocostalis thoracis laterally flexes the vertebral column to the same side. It is innervated by the dorsal rami of spinal nerves.
Okay. So next we have the longissimus. And remember, that's the one that's sort of in the middle here. This one originates on the posterior surface of the sacrum, the spinous processes of the lumbar vertebra, and also slightly on the iliac crest, and inserts into the ribs between the tubercle and the angle of the rib, also to the transverse processes of the cervical vertebra, which we see up here inserting into those transverse processes, and then lastly into the mastoid process. So you can imagine why this is called the longissimus, because this is the longest muscle of the three erector spinae muscles, starting all the way down here at the sacrum and extending all the way up to the head onto the mastoid process. So bilaterally, when they both work together, this is going to do vertebral extension. So sort of, again, starting into that back bend sort of motion. And then unilaterally, if one side contracts, it's going to laterally bend the vertebral column to the same side. So let's see this one in action.
The erectors spinae, the lumbar fascia, processes of S fibers run. The origins are from the thoracolumbar fascia, the transverse processes of L4 through L1 and T5 through T1, as well as the articular processes of C7 through C4. The insertions are to the transverse processes of T12 through T1 and C6 through C2, to ribs 12 through 4 between the angle and the tubercle, and to the posterior margin of the mastoid process of the temporal bone. Acting bilaterally, the longissimus extends the vertebral column and neck. Acting unilaterally, it laterally flexes the vertebral column to the same side. In addition, the superior portion, the longissimus capitis, laterally flexes and rotates the neck to the same side. It is innervated by the dorsal rami of spinal nerves. The erect.
All right, and then finally is the spinalis muscle. This one, again, is the most medial of the three erector spinae muscles, and this one originates on the spinous processes of the thoracic and lumbar vertebra, which you can see that, and inserts into the spinous processes of the cervical and thoracic vertebra. Bilaterally, just like the other two, it extends the vertebral column, and unilaterally, just like the other two, laterally bends the vertebral column and is innervated by the spinal nerves.
Column, and when most developed, it has the iliocostalis, the longissimus,
All right, so let's talk about spinalis here in this video. Just
and the
gonna start in 1
spinalis.
second.
The spinalis forms the medial-most column, and when most developed, it has 3 parts, as do the other muscles. These are spinalis thoracis, spinalis cervicis, and spinalis capitis. From their origins, spinalis fibers run superiorly to insert onto vertebrae, the ligamentum nuchae, and the skull. The spinalis thoracis is the least variable of the 3 parts, as well as the least blended with fibers of other muscles. Its origins are from the spinous processes of L2 through T11. The insertions, though somewhat inconstant, are to the spinous processes of the upper 4 to 8 thoracic vertebrae. The spinalis thoracis extends the vertebral column in the thoracic area. It is innervated by the dorsal rami of spinal nerves. The erector.
All right, and so here are some more tables for you guys, just to kind of summarize everything that we talked about in the posterior trunk. And the list of references that I used for this PowerPoint. So at this point, this is the end of the slideshow and the end of the lecture. So I will have this video up for you, and have a good week.